I am excited to talk to you today about the new way that respiratory therapists and nurses will document arterial blood gas draws. Imagine this. You are taking care of a patient that is having acute dyspnea. You receive an order to draw an arterial blood gas. You are prompt at drawing the specimen, and now you need to send it for results. But what information does lab need before resulting in EPIC? Previously, a paper requisition was used with written documentation of information like location of ABG stick, oxygen delivery method, and even ventilator settings. All the information filled out shows up on the final results and provides a clear picture of the patient while on specific oxygen therapies. Often, there was a delay with resulting ABGs due to inconsistencies in filling out the requisition. Therefore, we are moving the paper requisition documentation into EPIC. Starting on April 1st, you will no longer use the paper requisition slips unless we are in downtime. When an ABG is ordered in EPIC, persons drawing the ABG will complete documentation in EPIC that was previously on the paper requisition. Respiratory therapists and NICU nurses will access the required documentation from the work list. When you click on Document, an additional screen will prompt you to fill in multiple boxes. All the fields flagged with a red circle and exclamation point must have something documented. If the field does not apply to your patient's situation, then mark it with an NA. For example, if your patient is on 5 liters nasal cannula and not on the ventilator, then mark fields pertaining to the ventilator with NA. If you are in the ER, you will access the required documentation under your specimen collection task box in the ED narrator. When clicking on the arterial blood gas, a window will pop up, prompting you to fill out each box. Again, if certain fields do not apply to your patient, then mark the box with NA. Some of the fields have a lookup icon, which means that you will select an item from a drop-down list. This example is showing the options for device. Mode has a drop-down list that you will need to select an answer. Fraction of inspired oxygen also has a drop-down menu. You can select NA if this doesn't apply to your patient. Moving this documentation to EPIC will help decrease mislabels, decrease patient resticks, and increase accuracy and speedy turnaround times. With a shorter turnaround time, it could improve patient outcomes. Please contact your manager or your clinical education specialist with any questions.